Hey guys, I have had so many friends and patients asking me, what are you doing with your face? Your skin looks amazing. So I just thought I would kind of go over what I've been doing and bring you along with me today to Aesthetica. So I, of course, besides the Botox, I've been doing the Morpheus treatment. I've done 2 of the 3 that are recommended. Today will be my 3rd, and I will post befores and afters after this treatment today. The Morpheus is a microneedling that adds radiofrequency, and so when you get that radiofrequency, it initiates an immune response. So everything comes, cleans up kind of the micro injuries that are created during the treatment, and it's helping to build new collagen and elastin. So initially my skin will look really nice, glowy all over, but then it's going to help with laxity a bit. And areas that I've been bothered by on myself are the nasolabial lines, a little bit of the jowling that I'm seeing kind of through this area here. I'd love just to lift that a little bit. And then the neck. There are a lot of treatments that we can do, of course, on the face. I love Sculptura, and I have done a round of Sculptura, but I really felt like I needed a little bit more to my neck. So chose the Morpheus, started that a few months back. I've been a little bit slow to get in for my 3rd treatment because of the braces, and then also I have been in the sun a lot. Before the Morpheus, I like you to avoid the sun for a couple weeks. You need to be able to avoid it for a couple weeks after. The week of your treatment, I don't want you using any active ingredients or products that can be abrasive to the skin. I want you to be able to get some good healing afterwards. Another question that I get asked a lot from my patients is, does this treatment hurt? And yes, it does hurt a bit. I typically do pretty well with pain tolerance. You'll see today though, it is a bit uncomfortable. I will be putting a BLT cream all over, and I will let that sit for a half hour. So when you come to see me or one of the girls for a Morpheus treatment on the face, I either like you to put, I can prescribe a numbing cream, and I want you to put that on 30 minutes before your treatment, or I want you to come to the spa 30 minutes early and we will numb you good. There is a small charge for numbing if you choose to do it at the spa. But typically with the numbing, I do pretty good. Most of my patients do pretty good, but there is the option to do a laughing gas. We've got the Pronox available. So if you're one that you don't like to be uncomfortable and feel like you need that, it's always an option. So I'm gonna go ahead and go get numbing, and then we'll get in and I'll show you a little bit more about the treatment. Okay, here I am. I've got all my numbing on. So when you numb, I want you to numb all the way top forehead down to, your collarbone's fine. Make sure you get the sides really good. It's a little bit uncomfortable out through here. So numb your nose. I have some people forget their nose. Numb nose, upper lip, chin really good. I forgot to tell you, Morpheus is awesome for body too. So if you've got any areas of the body where there's laxity, you can treat that too. I am going to treat my stomach today. I've got this little area here above my belly button that kind of has some laxity. Like if I could just, get that to go away after having babies. So this, I hope, will improve some, but I will be doing my face and neck and then just a little bit to the abdomen area today. So we'll see you in the spa in just a minute. It's starting to feel a little tingly, which is good. That means I'll be nice and numb by the time we get there. I just wanted to elaborate a little bit on the body. I can't believe that I totally forgot to tell you about that. The body is amazing. There's so many different areas that it can help with laxity. Popular areas, of course, are the abdomen. Any laxity that's there, it will help to kind of lift that. And then other areas that I'm finding I'm doing a lot is that banana roll right below the butt. That will help with laxity to that area. Any of the laxity that people get on the backs of their elbows, above their knees. So there's lots of different areas that we can use a different handpiece. It's called the body handpiece. and it goes a little bit deeper and is really nice. It can hit lots of different millimeter depths in one pass. So it actually is a pretty quick, fast treatment to do the body. So see you in a minute. So this is the Morpheus, and it can do, like I talked about, body, it can do face. Has a different handpiece depending on which area we're treating. There's a body handpiece, a face handpiece, one that does resurfacing, and then one that's got a smaller tip that can get above the eyes, around the eyes. Today I've got the face handpiece here, and if we can zoom in closely, you can see as I deploy that, there's 24 little pins that kind of come out. And we can choose what millimeter depth we want to do, and every face is going to be a little bit different. So we'll go anywhere from 1 to 4 millimeters depending on what we're trying to target and the area we're trying to treat. So we're going to go ahead and get started. It's a little bit uncomfortable, so we got lots of different tools here to help with pain or discomfort. We've got a fan, a buzzer, got an implant that we can squeeze if it gets really painful.
I'm Raquel, I'm a nurse anesthetica, and this is Tiffany. She's one of our nurse practitioners here, and we both do the Morpheus treatment along with other providers, and we're just gonna do hers today. This is her 3rd treatment, and she came in with numbing cream on her face, her décolleté, and then also we're gonna do a little bit on her abdomen. But right now I'm gonna start by cleaning her off, and I have the setting set so we can target different areas depending on what the patient's goals are, but with her, we're gonna actually start on her neck, face, and then we'll end with her body treatment. So I'm gonna go ahead and get everything cleaned off to start, but I'm actually going to leave the numbing cream on her face so it can stay a little bit longer while I do the neck. So this is the face tip that we're gonna use on Tiffany. I don't know if you can zoom closer, you can see when I hit the foot pedal, the little needles come out. To get pretty close to the go along the orbital rim, which is an area that really bothers patients. So I'm going to get to the orbital rim, and I'm going to actually pull the skin down to get all the skin, so to help with these little fine lines she has right here. Okay.
Okay, so here's what I look like immediately after. A little bit roughed up, kind of red. Keep in mind, I'm uber sensitive, so I always get a little bit more red and a little bit more swollen than most, but I'll give you updates, show you what it looks like tomorrow and the next day. Okay, here's how it looks tonight, first night. I'm a little red, splotchy. I'm gonna keep it really clean. I used a little epidermal repair, and then my favorite, the ZO growth factor. I will put that on tonight, and I'll show you what it looks like tomorrow. Okay, so here we go. This is what I look like the next day. Still don't want you wearing makeup. A little bit of redness. But overall, not too bad. Okay, here is day 2. Looks pretty good. Still don't want a lot of makeup on. Little bit red, couple of spots, but for the most part, it looks pretty good for day 2. Hey, I forgot to video my stomach yesterday. So that's what the stomach looks like on day 2. It's a little bit more red. The body always takes a little bit longer to heal. Okay, here is day 3. I am headed out, so I did put a little bit of makeup on, but looks pretty good. Maybe you can tell a little bit of texture on my neck a little bit. You can still see a little bit of the marks from the procedure, but overall looks really good. So very minimal downtime.